What if I told you that a simple itch, one that most elderly people brush off as nothing, could actually be your body screaming for help? Not whispering, screaming. And here's the scary part. Most people over 60 ignore it for months, sometimes years. They think it's dry skin, or maybe just the heat, or something that will go away on its own. But it doesn't go away, and by the time they finally see a doctor, the problem has grown into something much harder to treat. Today, on Senior Logic, we are going to talk about something that almost nobody talks about: groin itching in the elderly, the warning signs, the hidden causes, and most importantly, what your body might be desperately trying to tell you right now. Stay with me, because what you learn in the next few minutes could genuinely change your health or the health of someone you love. Let me paint you a picture. Imagine a 68-year-old man named Harold, retired, active, loves his morning walks. One day he notices a faint itch in his inner thigh area. He doesn't think much of it. He changes his soap, buys some talcum powder. Life goes on. 3 months later, the itch is worse. There's a rash now. The skin looks different, darker in some spots, slightly raised. He finally visits his doctor and gets the news. What started as a simple warning sign had quietly escalated into a fungal infection that had spread deep into the skin folds, and worse, it had masked an early indicator of a blood sugar problem that had gone completely undetected. Harold's story is not unique. It happens every single day to elderly men and women across the world. And the tragedy? Every single warning sign was there. His body was waving a red flag from the very beginning. He just didn't know what to look for. So let's change that right now. Here is the first warning sign that almost every elderly person ignores: persistent itching that keeps coming back. Not a one-time itch, not something that lasts a day and disappears. I'm talking about itching that goes away for a little while, and then comes back again, like an uninvited guest that refuses to leave. Now here's what most people think. They think it's sweat, or fabric irritation, or aging skin that's just more sensitive. And sometimes, that's exactly what it is. But here's where it gets important. When the itch returns repeatedly, especially in the groin, inner thighs, or skin folds, it can be an early sign of a fungal infection called tinea cruris, also known as jock itch. And in the elderly, this condition behaves very differently than it does in younger people. In younger adults, it often clears up fast. In the elderly, the immune system is slower, the skin barrier is thinner, and the warmth and moisture trapped in skin folds creates the perfect environment for fungus to spread deeper and linger longer. So if you or someone you know has been dealing with recurring groin itching, do not dismiss it as just part of getting older. That's warning sign number 1. Warning sign number 2 is one that makes most people deeply uncomfortable to even look at: skin changes, redness, darkening, or unusual patches. Picture this: the skin in the groin area begins to look different. Maybe there's a reddish ring-shaped patch. Maybe the skin has turned darker than the surrounding area. Maybe there are tiny bumps, flaking edges, or a border that looks almost like a map outline. These visual changes are not cosmetic. They are clues. That ring-shaped rash with a clearer center? Classic sign of fungal activity. The darkening or thickening of skin in folds? That can signal a condition called intertrigo, which is inflammation from skin rubbing against skin, made worse by moisture and heat. But here's what makes this truly alarming for the elderly population specifically. Darkening or thickening of the skin in the groin area can sometimes indicate something far more serious: acanthosis nigricans. That's a condition directly linked to insulin resistance and type 2 diabetes. Think about that for a moment. A simple skin change in the groin could be your body's earliest visible warning of diabetes, a disease that affects hundreds of millions of people, many of whom have no idea they have it until it's already causing organ damage. This is why these visual changes should never be ignored, especially in seniors. Now I want to talk about warning sign number 3, and this one catches people completely off guard. A smell, an unusual odor that wasn't there before. This is deeply personal and most people will never bring it up with their doctor out of embarrassment. But it matters enormously. When bacteria or fungus overgrow in the groin area, especially in the warm, moist environment common in elderly individuals who may have mobility challenges or incontinence issues, an unpleasant smell develops. It's different from regular body odor. It's stronger, persistent, and it doesn't fully go away with regular washing. This smell is a biological alarm. It means the microbial balance of your skin has been disrupted. And in the elderly, this imbalance can quickly spiral into skin infections, open sores, or secondary bacterial infections that become extremely difficult to treat. If you've noticed this change, please do not let embarrassment stop you from seeking help. Doctors see this every single day, and catching it early is everything. Warning sign number 4 is the one that sends the clearest signal that something is seriously wrong. Pain, burning, or a stinging sensation. Itching alone is one thing, but when that itch crosses into burning or stinging, especially during walking, sitting, or after using the restroom, that is your body's emergency alert system going off. In the groin area, burning and stinging can point to several serious conditions. It could be a severe fungal infection that has broken down the skin barrier. It could be a bacterial infection that requires prescription treatment. In some cases, and this is important to hear, it can be a sign of nerve pain related to shingles, which in elderly patients often begins with burning or tingling in the skin before any rash appears at all. Shingles in the groin area is more common than most people realize, and it is notoriously misdiagnosed in its early stages. The burning can last for days before any visible sign appears, and the longer it goes untreated, the more severe the nerve pain becomes, sometimes lasting for months or years in a condition called postherpetic neuralgia. If you're feeling burning or stinging in your groin area right now, please see a doctor as soon as possible. Time matters. Warning sign number 5 is subtle, quiet, but dangerously important. Swelling or lumps in the groin. Now, I want to be very careful here because I don't want to create unnecessary alarm. Small swellings near the groin can have simple explanations. But in the elderly, a swollen lymph node or unexplained lump in the groin area that persists for more than 2 weeks must be evaluated by a medical professional. The groin houses major lymph nodes. These nodes are part of your immune system's surveillance network. When they swell, it means your body is fighting something, usually an infection nearby. But in some cases, persistent lymph node swelling can be an early indicator of something that requires immediate medical attention. I want you to remember this number: 2 weeks. If you notice swelling in the groin area that has not resolved within 2 weeks, or that keeps growing, please do not wait. That is warning sign 5, and it is the one that most urgently demands professional evaluation. Now, let's talk about why the elderly are so much more vulnerable to all of these warning signs. There are 3 reasons that doctors talk about most. First, the skin naturally thins and dries as we age. The protective barrier weakens. Moisture gets trapped more easily in folds, and healing takes longer when something goes wrong. Second, the immune system slows down. What a younger body fights off in days can linger in an elderly person for weeks or months. Infections that seem minor can escalate quickly. And third, this is the one nobody talks about, many elderly individuals live with undiagnosed conditions: diabetes, circulation problems, autoimmune issues. These conditions create the perfect internal environment for skin problems to explode in the groin and other sensitive areas. Your skin is not just skin, it is a mirror of what is happening inside your body. And the groin? It's one of the most sensitive mirrors of all. So what do you do right now? First, take these warning signs seriously. Recurring itch, skin changes, unusual odor, burning sensation, or persistent swelling, none of these are things to wave away. Second, keep the area clean and dry. Use gentle, unscented soap. Pat dry completely. Breathable cotton clothing makes a significant difference. Third, and most importantly, see your doctor. Not next month, not after it gets worse. Soon. Bring this list of warning signs with you. Tell them exactly what you've noticed and for how long. Ask about fungal testing, blood sugar screening, and whether shingles vaccination is right for you if you haven't had it. Here is what I want to leave you with today. Harold, the man I told you about at the beginning, he got treated. He got his blood sugar under control. He's still doing his morning walks, but he always says the same thing when he talks about that time. He says, "I wish someone had just told me what to look for." That's why Senior Logic exists. That's why this video exists. You deserve to know what your body is trying to tell you. You deserve to catch things early, and you deserve to live your best, healthiest life, because age is not a reason to stop paying attention to yourself. It's the most important reason to start. If this video helped you or someone you care about, please share it. Leave a comment telling us what you learned today, and subscribe to Senior Logic, because every week, we're here giving you the information that truly matters. Take care of yourself. You are worth it.